Welcome to another episode of Aligned and Elevated. I'm your host, Dr. Allison Feldt, owner of Body Motion Physical Therapy, and today I have the director of Body Motion, Dr. Katrina. And so, thank you for being here.
Thanks for having me.
What are we talking about this episode?
We are going to talk about the clinic today.
Okay,
You
love
excited?
that. I'm very excited.
Yes.
Okay, so Dr. Katrina, just to give you a little background, she is a doctor of physical therapy, pelvic expert physical therapist, and she runs Body Motion. She runs our Edmonds location. She touches base with our director at Poulsbo, which is Dr. Riley, and she has been, I breathe easy and sleep easy at night because Dr. Katrina carries the stress. No, you do carry.
I still sleep well. It's okay.
Okay, good. You carry the load, and it's been such a blessing ever since you have arrived. So thank you.
I was thinking about that the other day about how just the timing, how good it was, because I think we had just moved back to the area. I was pregnant, and I reached out to you, I think via email maybe,
yeah,
and just said, hey, any chance you're looking to hire like a part-time PT? And you like quickly got on the phone with me, and the conversation went so well, and then I came in for the interview, and the rest is history. But
yeah.
Just, sometimes timing is everything.
It really is. Oh, what a blessing. I remember you were like, I also want to be the director, and I was like, absolutely. I was like, let's make you a pelvic floor physical therapist first, and then we can see where this goes. And
then you conned me into taking the director role right out of maternity leave.
Yeah.
So
I had to get you back.
No regrets. It was great. Well, let's talk about the clinic today, because you have created this beautiful. If you haven't been to our Edmonds location, it is water view. When the mountains want to come out, you see the whole Olympic mountain range from some of the rooms, and it's just a spa-like vibe in here. And I always said, like, if I ever run my own clinic, which has never been my dream, I would want to make it feel like moms are coming to the spa, right? And you've definitely created that here, let alone just, I think I'm a little bit biased, but the culture of everyone that works here. So why did you want to create that vibe? Like, what made you think, like, this is what moms need?
Our life is chaotic. It's hard to find peace. And when I go somewhere, like, I like to go to the gym. I like to go work out at the gym. And if I'm going to go do exercise, I want to go to the gym. Mm-hmm. I don't want to go to the gym and spa. Right. I love going to the spa. It's always been a thing for me. I also feel like the reason I put the clinic in Edmonds was I just felt healing happen here. Every time I dropped into the bowl, I'd be coming from Seattle or coming from my house somewhere and coming into Edmonds, and you just breathe a little easier. Like, your shoulders just relax. You see the mountain range. You see the Puget Sound. It is gorgeous. And so you just feel a little bit more down to earth. You feel a little rooted. You just feel good. And so it's such a good platform and basis for healing to begin and continue. And so that's why I chose Edmonds, and that doesn't really answer why I wanted a spa-like vibe. I just knew that part of what we do as far as pelvic floor work is we downregulate the body. Mm-hmm. We help bring people out of their fight or flight stress responses. That's a normal part of life. It's healthy. Like, you want to have normal stresses in life, but there's also this air of, like, women carry a lot. Most women I know are like type A, they run their family, they do it all, right? Mm-hmm. And so the minute that they don't need to be going to the gym 24/7, they don't need their pelvic floor physical therapist to be in a gym. They need their pelvic floor physical therapy to be down-regulating, to be relaxing. And that's why I wanted a spa environment. What's not relaxing for me is to see vaginas on the wall. Yeah. I don't want to see...
I love that you're pointing that out. It's true.
I don't like that stuff. Mm-hmm. I don't like... I know a lot of pelvic floor PTs love, like, the vagina art and, like, get down on that, and that's fine. But, like, I just like it to be peaceful. And so we have nice paintings in the clinic, and we have, pretty mirrors, and we don't have, like, a ton of anatomy pictures hanging on the walls. Like, we just don't have that. We have, models, of course, and we have pictures that we can take out and show people, but we really do try to keep the vibe, like, super spa-like, super elevated, so you can just be relaxed and, like, really come home to your body. Mm-hmm. And that's what I wanted. I wanted it to be a place that I wanted to go every day, and I always want to go to the spa, so I was like, build it. That's how it came to be.
And I love that differentiation between walking in, because it sets your mind kind of like, okay, now I'm at my public PT appointment, I can kind of take a breath. And then even coming into work here, if it's been a stressful ferry commute for me, I can walk in and it's like, okay, I'm here, I'm in this peaceful environment. So I think that mind shift just going into the appointment is so huge for all of our clients. And for anyone wondering, because I've had so many questions about it lately, the art on our walls is beautiful here. I just love it. And it is Dr. Allison's aunt, who has just created all this beautiful artwork. So
Sally Willie. We'll link her.
Yes,
we can link her. She sells all her stuff. She's a pretty renowned artist in the Midwest and is in a ton of art galleries, and she has it actually. It's so funny we're recording this. My mom and her are in Michigan right now. They're going to an open house for her art tonight.
Oh, cool. So you have to share like a snap of the pictures from the art
I totally will.
Yeah.
Oh, I'm so glad you threaded that in.
I've had so many questions about it lately, so I'm like,
okay.
Dr. Allison's aunt.
Okay, great. Let's and they're all for sale. I just don't know how to sell them, but we reach out to Sally Willie and she can tell you them.
I love it. Okay, and then aside from obviously the vibe being a little bit different than maybe what you get at other clinics, what do you think differentiates Body Motion, PT, Edmonds, and Paulsbo apart from other PT clinics that also do pelvic floor?
Yeah, I really think it's a mindset. Like we look at, and I think every pelvic floor PT wants to tell you they treat holistically, they treat the whole body, and I hope, you think that's the case, but especially in back up here, but in insurance-based practices, you get a referral for incontinence, and you're like, I'm going to treat that incontinence, right? Mm-hmm. Like that client's coming they're peeing their pants. What we've learned is first off, no one's a freaking diagnosis. Mm-hmm. And so we get to know the person, right? Mm-hmm. And we get to know what their hopes and dreams are for their next 6 months, for their next year, for their next 5 years. Mm-hmm. And when we start from that place and work it backwards, sure, they might have a little incontinence, but it might be fucking irrelevant to them. Pardon my French. They just really don't care that they're peeing their pants, but they want to feel really strong during delivery, And it's when you work it backwards, I think, from what their goals are, who they are as a person, and where they see themselves in the future. And a lot of times women haven't even been asked that question. Right. And so they don't even know how to start there, but it's a good talking point, and it just allows us to see people as they are fully, instead of just being so you're here for your incontinence, how often do you pee your pants, you jump on the trampoline and you pee your pants, okay, we'll deal with that, here's why you pee your pants and we're gonna go. Yes, we have all those conversations, and we don't focus on necessarily the diagnosis themselves. We focus on optimizing the person, and I think that's what differentiates us from just maybe your standard insurance, I got a referral from the doctor to fix this, and not fully realizing why you need to fix that, or why that's maybe important for your future self in 5 years who's going to go do the Ironman, and I think that's our biggest differentiator.
I love that, and I think because then if we just fix the incontinence, right, it's okay, see you later, bye, but there's still all these other issues that might be presenting as dysfunction that they don't even realize. I can't tell you how many times I've had clients come in and maybe they're coming in for incontinence, but then when we dig into it, there's actually X, Y, and Z also going on, because no one's ever asked them those questions, right? Yeah. And so it's kind of putting together the whole picture, the whole body piece. We could treat that. So yeah, I think that's a huge differentiator.
And when you ask those questions, they don't even realize oh, that's actually something you can help me with. Right. I thought I was always gonna be gritting my teeth during sex. I didn't realize that could actually feel good for me. Oh, it's not supposed to hurt when that happens? Yeah. No.
Oh, if I sit for 2 hours, my tailbone shouldn't hurt?
Yeah.
Oh, yeah, no.
No, that's not normal. Oh, okay. So, but it's super common, and we see people with this kind of pattern experience that. So thank you for sharing, And it's and I think that just also gives people hope. Mm-hmm. But it also leads me to women are just badasses, right? We go and we have babies and we experience excruciating contractions, and our bodies change crazy for 9 months, or you deal with years and years of infertility, and it's this emotional pain, and or you have menstrual pain since you're 14 when you start menstruating, and pain is just almost ingrained and accepted. And so women especially, and I'm sure you see this too when you talk to clients, they don't tell you they have pain. Women do not freaking identify with pain because they're so freaking strong. And so they might say they have
used to it.
Discomfort, or it bothers them a little bit, but they're used to that. like they go 5 days a month with severe cramp and can barely get out of bed. Yeah, they have some pain or some discomfort, but it's like so minimized. But like you're stuck in bed, you know, or like you're willing yourself to get out of bed. And it's like the amount of what I guess I'm trying to convey is like the women just like kind of take it and go.
Right.
And I think that's it's badass and like it's what we've had to do as we've evolved. But there's also this vein of like, so there's no research supporting how we can help women with menstrual pain unless we give them birth control pills and unless we decide that they need uterine ablations and then hysterectomies or endometriosis surgery. And it's like, holy cow, like that's what we decided versus having like a more holistic approach and like things that we can actually help with as far as from a pelvic floor physical therapy standpoint. So I don't even know your original question, but I think you didn't even ask the question. I was just responding to like this pain situation, and I think so many of our clients just same thing. They don't even see themselves as having pain. So when you start to ask them these questions, and they realize like, oh, I don't have to experience that, and my body can feel this good. We're just unlocking like a different level of their potential that will help society and all the beautiful things.
Well, let's talk about that because you just recently kind of had that quote of if we can unlock women's potentials, like by making them feel good in their bodies again, like without pain, or maybe they're just functioning better, like what that does for their lives and society. Like talk about that a little bit.
I mean, I used to think it was a coincidence. No joke. I was like, why? I would tell Devin, why does every woman that come here, they want to start their own business or they want to start doing this for other people? And I was like, it's such like a virtuous thing too. It's never like I'm going to go, build something that doesn't affect anyone. It's always like contributing like massively to the world, like some act of service, right? Like some way to move society in a better direction.
Caregivers, us women.
Yes. And it's like everyone has like such amazing contributions or like creative ideas after they would come out of therapy. And you're like, or pelvic floor physical therapy specifically. And you're like, wait, I was just working on their pelvic floor and like and you're literally, when you have pelvic floor work done, and if you've never had it, I cannot suggest, like you need to have it because like it's that epic. And it doesn't just free up your core and give you a stronger core and protect your joints in your future and save you joint replacements and bladder replacements, because it does do all those things. But there's like a way deeper level where it just unlocks your potential.
Right.
Like it does. And when we get the core functioning well and we get your body well and we get you feeling really good, there's just this element of like, you can unlock your creativity. You can unlock what you think you can more identify who you are in your body. You can start to establish who you are as your unique self. And when you decide who you are as your unique self and you really truly like can get into that person, which a lot of people don't have the luxury or privilege of doing because we're in this fight or flight, go, and we feel like shit, or we're barely hanging on, or it's just chaotic mom life, yada, yada, yada. But when you start to go into yourself and heal yourself and fix yourself, it truly does unlock something inside of you to go build your empire, to go build whatever you want and to contribute to this world. And like it helps you to really get further in touch with yourself. I hope this is making sense. So that when you get further in touch with yourself, you can truly decide like and figure out what is your reason for being on this planet. What is your mission for being here? Why were you put on this planet? I can go on and on about this.
No, I love it. And it's so relatable because, and for anyone listening who's had any sort of pain, whether pregnancy, postpartum, perimenopause, that chronic, like low level pain just drains your energy. It's like then you have no energy left over for your kids when you get home from work. You have no energy to do anything fun on the weekends with your friends because you're just trying to get on top of this pain. You can't work out because then you can't take care of yourself, right? And so just to like be able to fix that dysfunction and not have that energy suck every single day. And I mean, I had that for 18 months postpartum, right? And now it's like, oh, okay, I do want to take that course for work, or okay, yeah, let's go on a vacation. I have the energy to maybe do a hike, It's just the amount of things it unlocks for your quality of life, I think, is so huge. So huge. Yeah, I love that so much. Okay, so then tell me how like, you know, taking the vibe of the clinic, this unlocking like women's potential is kind of your mission. And then how did you kind of put that into your protocols that we have here? You know, our birth prep, fertility, etc. But just in general, having a protocol at all for pelvic floor PTs.
Yeah, so as we grew the clinic and we brought on more and more providers, it was really important to me that, say, Megan refers her friend Brianna here, it was important to me that Brianna got the same experience as far as her birth prep goes. Obviously very individualized for Brianna's body versus Megan's body. But if Megan had this really good experience and like she got the birth of her dreams and, you know, she prevented prolapse and did all these things because of our protocols here, who she worked with here, I wanted that to translate to who she was sending here. So that's why. I mean, that's why we wrote the protocols. And also I could have a bigger impact than just keeping it all in my brain.
Right.
And I think after years and years and years of like really threading together and like seeing these patterns in people after people, you really come up with like, all right, when people are pregnant and you give them X, Y, and Z, and you do it at these weeks through your pregnancy and cover this in the first trimester, this in the second, this in the third, they're going to be set up for a really successful vaginal delivery or C-section. And so I think that's why we had to put the protocols in place. And I mean, it's amazing because for me it gives me peace of mind because I know that like when my best friend comes here, like for her pregnancy and delivery, or when my sister-in-law comes here, it's like I know that they're getting all of it.
Right.
You know, and you know, it took years and years and years to put these protocols together, and you know, you've been on the forefront. I think the fertility protocol was developed when you were here, and so it's like as we've learned and seen patterns change and see women evolve, as women evolve and change and what we're seeing in society changes, right? We have to change. And so our fertility protocols have definitely like evolved as well, and I think only have gotten hugely, vastly better, especially with our regenerative technology. And so, yeah, I mean, we've done that in order to make sure that people get the care that we want them to get, and so that they can get knocked up how we, you know, how they want to get knocked up, and we can be on that journey with them, and we want everyone to, you know, it's very individualized to everyone's body, but the framework, like you mentioned earlier when we were in a previous conversation before this podcast, you were really like, it's the framework of how we deliver the protocols. Because really, like, every provider has their own autonomy in how they're going to deliver it and everything like that. But I think it's, I hope that it does that answer.
Yeah, it does. And I think I love how, as a provider here, and for anyone who's not been to our clinic, you know, we get to bring our background into our treatment, right? Like, we've got people with different ortho backgrounds, you know, I have a neuro background, and so we all kind of have our different spin on how we treat, but our foundation is the same. And I think as a provider, it's cool to have that autonomy, but also have a little bit of a guideline. And with these certain clients, like, we kind of know the drill for how we're going to treat them. Of course, we get those, like, random, like, complex, you know, clients, and those ones are fun because we can work together as a team to figure out how we're going to work with them. But the ability to bring our own kind of unique spin is really cool, but also using your protocols. So, just a really neat thing you've created. And then to put you on the hot seat here, but what would you say if someone said, oh, hey, are your protocols based on research?
They're based on clinical research.
Perfect.
Yeah, 100%. Clinical outcomes and clinical research. Because the reality is that, first off, most research is like, the evidence don't necessarily support this. Don't necessarily support this, you know? Or like, it's just so convoluted, right? And it's hard, I think, especially with pelvic floor physical therapy. Okay, so you're having them do Kegels, you're having them do all these other things. How can you pull out what's actually working? So that's why I'm saying this is years of clinical evidence.
Functional patterns,
and
right?
functional patterns. And a little bit of common sense.
Yeah.
I think.
Totally.
Of like what we know we need the body to do so the uterus can have a baby and push the baby out of the body. And so that's the evidence, that's the research. It's really based on clinical research.
And tell me about how like client feedback has kind of helped with that too. I mean, you hear clients say like, oh my gosh, this worked, I pushed my baby out in 20 minutes, or, you know, now I'm able to run again without pain or leaking, like,
Yes.
you hear those stories, right, and then you know, like, well, of course, this is working then, right, like, it's not just, I treated them and then they never got better.
Totally.
Yeah.
Yeah. It's still though, like, it still hits me, especially with the birth stories.
Yeah.
Like, even like C-sections, like these emergency C-sections, of course we get emergency C-sections. Clients will, you know, do our protocols and hope for a vaginal delivery and like do everything they can to show up for that vaginal delivery. And what will and like, there are certain things like a short cord or like the baby's not descending. Like, there are certain things that we can't, or the decels, you know, that we can't change, or like a breech baby. But a surgeon, time and time again, telling us that, or telling our clients that it was so easy to get your baby out. Like, we didn't have to work like we normally have to work to get this baby out for a C-section. Time and time and
guess what? There's no research on that, right?
There's no research.
There just isn't research. There's not enough, and I know there's more and more coming on women's health, hopefully, but there's just not enough out there to say, like, this is this and this is that in every single instance that we treat.
Yeah.
Or diagnosis.
Yeah. It's going to take 100 more surgeons saying that, though, to our clients for me to be, like, to really hold on to it.
Totally.
Because, like, even now, even still with the vaginal birth, it's like, it's an expectation, to be honest with you, probably because we've had over probably 1,000, you know, thousands of births, that, like, at this point, like, it doesn't blow my mind necessarily when a first-time mom is like, I have a 10-pound baby and breathe my baby out in 2 breaths, you know?
No tearing,
with no tearing. And so I'm like, perfect, good, exactly what should have happened, you know, I'm like, textbook, good, you know? And so it's like, I still get I get the oxytocin hit every single baby that's born, but like, that's almost an expectation, but it's taken hundreds of births to get there. And so I think once we got into the upper hundreds, it made me feel like, okay, this is a serious thing that we're doing. This is changing lives, like, and this is making a world of difference for these birth outcomes. Then we wrote the protocols.
Cool.
And I guess the rest is history. But it still frustrates the shit out of me that it's not like research based per se. And that's where it's like, I know a lot of PTs and a lot of clinicians and a lot of doctors want to hold on to that. This isn't research based, but the reality is like the clinical outcomes are all there, right? And we've tracked birth outcomes for a long time, and I think the fact of the matter is, like, when we have nurses, like, some of our biggest population is OB nurses, and it's because they see our birth outcomes, and so then they travel here from the east side, or they travel here from way north end, or from Seattle,
or doulas,
because they're like, nope, we've seen your clients deliver, right? And
we want that.
We
Whatever
want
you're
that.
serving, we want that.
Yeah, and so they come here for the body motion birth prep protocols.
Yeah.
And I mean, that speaks volumes, especially when like OBs and midwives are like, no, you need to go here. You know, it's like, oh, okay. Yeah. I mean, that's the reason for the birth prep protocols. That's the reason for the protocols.
Yeah, love it.
Yeah.
And what coming back to the clinic and the team a little bit, what are you most proud of when it comes to like the team dynamic here?
You.
Oh. Wow, I'm gonna blush.
You should.
Oh,
I mean,
gosh.
I have a lot of faults. I can get very big picture, and I can move really fast.
Yeah.
And I love my people so hard, and when I've hired everybody, like, they were the right vibe, the right fit, just freaking perfect in like that realm. But that takes continued nurturing, and I love all my relationships with all our teammates, and like, I mean, I was late to our initial meeting this morning because I just had to like catch up, right, with everybody here. But that's not possible if we don't have someone like consistently carrying the vibes, which is you. Like, you are consistently here to kind of keep the vibe. And I mean, all of our teammates bring it. They could be having the shittiest thing happen at home, and you just wouldn't know it. Right. Like, we hold space for all of that, of course, but they show up just like, because they know that they're changing the world. Like, they are changing the lives of people that are going on to change the world. And like, that act of service, to bring that to women every single day, like that fills you up. I literally was just talking to Dr. Victoria this morning, and she's like, she's so pumped to go to 2 days a week. She's increasing her hours after having her first child. She came back at 1 day a week. And she
love that flexibility, by the way. If anyone's curious, we're very flexible here.
Yeah, because we want to support everybody's whatever they need, right?
Totally.
And like we all thrive at different ways, but like one thing I said to her is I was like, you could be working at JCPenney's and you could get your cup filled because you get to have all these conversations. I was like, but it's like extra special because you get to go and like change these lives now twice 2 days a week, right? And she's like, yeah, it's like that fulfillment you get from like seeing Bethany have her first vaginal delivery after a C-section, like you did that, like you helped her get there, and it's like that kind of fulfillment doesn't come like, I mean, I'm sure it comes in other aspects and you would get very similar vibes somewhere else, but like because of the fact that what we do is so an act of service, a true act of service, it's like, I mean, it's so special. I don't even know what the question was.
No, it's a good, and it's even a good reminder for me to hear you say all of that, because I remember I was, before I made the full switch to women's health, and long story, but moved out to the East Coast for 9 months. I was a travel PT there at a hospital, and I just remember telling all the people I work with, they're like, oh, I just want to work with moms all day. I just want to talk to moms all day. That's what I want to do. Like, I just want to switch to women's health so badly. And now that's what I get to do. And like, and that wouldn't be possible if you hadn't have created this clinic and like this, you know, dream position, right? So it's pretty cool that not only are we getting to serve and help improve, you know, moms and other women's quality of life, but like you've also helped improve our life to where now I don't have to work at the hospital that I don't want to work at because I get to be here. So yeah, so like full circle. Yeah,
it's beautiful. Yeah, I was just thinking today when I was driving in, actually. So I'm off of a week of vacation, not coming into the clinic, and when I was on my way in, it was like my hope for everyone is that they have this exact same feeling coming back from vacation. Mm-hmm. It's like I want every single one of our employees to be like, I'm so excited to go to work today. Like I didn't have 1 ounce of dread. Like I maybe don't want to respond to like all the emails or like, you know, whatever. Sure. But it's like, but it's like I could not wait to come get the vibes from the people here, totally. Right? And it's like I'm not even treating today. But it's like I get to come in. When I found out you were going to be here today, I thought this was going to be virtual.
I was like, why are you so surprised I'm here?
And I'm like, I didn't know.
I'm not usually in on Mondays, guys.
We're recording this on a Monday. Yeah. And, but like, and like, even just to like see Devin and Taryn and like, it's like, it is just so high vibe. Like to come into work and feel like you make a difference and like you want to be around people and like, I hope everybody's life is equally as good on vacation as it is when they come back into what they love to do and what they get to do every single day, because it's truly what we get to do.
Right.
Like we get to create the life we want to create. Right. And, you know, for me, this is a huge piece of that. And I hope everyone who works here feels that too.
I think they do. They do.
Yeah.
I mean, I hear it all the time. And everyone loves when you come in because obviously you're off doing some other things too, high level. And I know everyone looks forward, like, when's Allison going to be here? And love to get the little, like, Dr. Allison, you know, sprinkle every now and then too. So, okay. And then, so what would you tell maybe a new grad coming fresh out of PT school? They're maybe interested in pelvic health, but a little nervous to like jump in, or maybe they know like, hey, I want to go full force pelvic floor. Like, what advice would you give them in like maybe even treatment for the pelvic floor and just like where to find mentorship, but also where what to look for in a job?
Yeah. I mean, look for a job that treats the whole person. Look for a job where you can develop relationships, not just with clients, but with your, you know, people around you. I think that's what's so special. That's like one of the biggest reasons I wanted to build a team. I wanted support and validation initially for like everything I was seeing. I'm like, do
you see this too?
Is this real? Did this really happen? Did she just have this baby?
Dr. Riley, I need to know.
Yeah, exactly.
Yeah.
And like it was like, so like to have those people around you, it was so important. I feel really fortunate in my career that I had extremely good mentors. That's where I learned so many of my techniques, and it's like when I had mentors that practiced Feldenkrais techniques and mentors that treated hypermobility syndrome and Ehlers-Danlos syndrome, and I had mentors that like just had pelvic floor physical therapy clinics, and to see all the different things and be able to thread that into like my practice and kind of create my own little entity of what I did. it was all really, really supportive, and especially in PT school, I don't know what it is like now, but like,
Right.
you know, we had 2 lectures on pelvic floor physical therapy.
I think it's a little more,
So-
but it's probably not a whole semester.
Yeah, right. And so like to know that you're getting like the most top quality teaching and training, and anyone we onboard here, it doesn't matter if you've had 20 years experience or
Right.
2 or none. It's like we put them through training. Like we all want to make sure that our skills are just next level.
Right.
And like we can learn from every clinician just like they can learn from us.
Yep.
And I think it's like the mindset of that, just knowing, like we loved having a new grad that we recently trained
Yeah.
because it was like, oh yeah, like okay, tell us what's new, like you
Yeah.
know, and then we get to teach them all of our techniques and like things that we've learned that work for our clients and things that we've built into the protocols because they're just that successful. And so yeah, I think mentorship is huge. And really truly making sure you're gonna get that mentorship. And that just obviously we all know that doesn't happen really in an insurance-based situation. Just because
we've spent like a month training people, and sometimes it's shorter, sometimes it's longer, but it's all very skill based. So if someone's not ready, then we're not setting them fully free yet, right?
Yeah.
And not even training on evals, and so pretty cool to have that kind of one-on-one mentorship and support here. I think it's unique.
Yeah. So I think that's good. And then really like we have people. Like, I think even when you started, it was like, well, what was your education? Like, okay, I took some NIOM courses, I took some Herman and Wallace courses, but really it's like, you can kind of take that education, you can take Herman and Wallace or APTA, and it's like, but how are you going to thread it into your own practice and create something that's actually tangible for you, to help people really truly unlock their potential, and I think that's where we've really we've created a different thing here, a different entity.
And if there's someone out there who is really like a little bit interested in pelvic health but has like strong ortho skills and loves ortho, would you tell them, hey, still consider pelvic floor, or like, no, you're not going to get as much ortho in it?
Your ortho patients will get 10 times better if you learn pelvic floor physical therapy.
Yeah.
Like if you learn how to read the pelvis and learn how to treat the pelvis, you will understand that how much that knee pain, that plantar fasciitis, that hip pain is, if not rooted in the pelvic floor has been a product of what's happened there too. So it's like you are just such a better ortho PT, and every single pelvic floor client, everyone has a pelvic floor, everyone has joints, right?
Yes,
it's 100% interrelated, and we are ortho PTs, we are neuro PTs, and we are pelvic PTs. It is all one and the same because we treat the entire system.
And sports, we're doing the return to running, being able to jump and lift again, and kind of how to help navigate
making
all of
sure
that.
I can hit my hockey games.
Yes, exactly.
Making sure, the next person can go to CrossFit and or does go to CrossFit, comes here to rehab, goes back to CrossFit. Now, we're not getting post-op knee replacements or an ankle fusion or a shoulder rotator cuff repair, although with a regen, we see a little bit of that too. But everyone's an ortho client. Every pelvic floor client is an ortho client. Like we're treating some other part of their body as a piece of what's happening in the pelvis too.
Yeah, I once had a PM&R physician tell me, in neuro, we also need really good ortho skills because it's still a lot of manual joints, with the spasticity, contractures, all the neuro stuff. And that really hit me because I was like, okay, I shouldn't just ignore my ortho skills, right? Like, because you get so neuro focused. And I think the same thing goes for pelvic floor, right? We can't just treat only the pelvic floor and forget about all the ortho stuff we learned in school. Like, it really has to be combined because we are treating the hip joint and the knee joint, like you said. So, I think that's really cool. And just an exciting thing to think about if you're a new grad, or you've been in a couple years with ortho and you're kind of interested in the pelvic floor world, it doesn't have to be all or none, right? Like you can do both. They both work well together. So, and some clients come in and we don't even treat their pelvic floor. We're just treating them from a kind of women's health lens.
Yes.
But very ortho focused. So
absolutely. Yeah. Thank you for asking that.
Okay, and then maybe final question. We'll see. What is your vision for body motion PT or just pelvic floor rehab? How do you want to see it change? Let alone Edmonds, Seattle area, and then even just through the nation. What's your vision for what pelvic floor rehab will look like in 5, 10, 20 years?
Yeah, I mean, I wish every single woman could experience true body motion protocols. You know, I mean, that's my honest opinion. Like, I wish my Aunt Sally didn't have to fly here from Chicago to, like, come get her pelvic floor worked on and, like, her hips fixed and her back's tuned up, you know? Now, does she have some people that can piecemeal it in Chicago? Sure. But, like, the difference in care when she comes here, it's like, it's just night and day, you know? And, like, she has wonderful providers. They just don't know what we know, right? And so... but we don't know what they know. So, like, everyone has, like, beautiful platforms where they come from, but I think how we've put it together from a body motion perspective is so epic that like, my dream of dreams would be every single woman across this nation has access to body motion protocols, truly and foremost. And, like, if we could just get every single pelvic floor provider and hopefully 10 times the amount of providers, because there is not enough providers to service all the women that need help, and every single woman deserves pelvic floor physical therapy, even if you don't think you need help. So it should just be part of, like, maintenance care and, like, feeling good in your body, just like you would go get a massage. This should be that, right? Because then you are much stronger in your entire body. So if everyone could have body motion protocols across the nation, I think that would be the dream, right? Because then you just know you're unlocking so many women to go feel good in their bodies and feel good all the time.
Well, I mean, I think it's our bread and butter here, and it's. I talked recently at a course to a newer grad who's like, well, I just don't, see as many pelvic floor PTs or PT clients as you, and I'm like, well, you're right. That's all I treat all day long is, like, people coming in for a pelvic floor dysfunction, even if there's other things going on, and so it takes so much of that, seeing them day in and day out for weeks and months to, like, you put the patterns together almost faster, right? And you, like, learn how to treat the pelvic floor even faster than someone who's maybe at an insurance-based clinic with ortho coming in, and then they maybe see 2 or 3 clients a week who have pelvic floor too. So kind of a unique thing here where we can really get to know the pelvic floor faster and treat, and if we could just get that to more people, right? So, like, how do we get more people so that they can also have the opportunity to treat more pelvic floor clients?
Yeah, and unfortunately, and I say unfortunately because I think this is ingrained in us from when we're in school. Like, when we're in grad school, I think you think that your effectiveness as a physical therapist is based on how quickly can you get someone one and done with you. Can you get them better in 3 sessions? Like, sure, we can get someone continent in 3 sessions if it's not super severe, but like, the reality is, like, that doesn't do shit. Like, they're going to be incontinent again in 3 more months. Because you didn't change any of their patterns or fix any of their stuff or teach them how to maintain their pelvic floor function. And, like, everyone needs maintenance. Like, life isn't just, like, peaches and buttercups. Like, we're constantly, I don't even know if that's a saying. I think I just made that up.
I don't know, I like it.
Peaches and buttercups. But, like, we're constantly trying to create a balance, right? Like, you're always going to be walking a little heavier on your right leg than your left leg, or vice versa. And, like, it's, like, just this constant ebb and flow of balance. And, like, are you training for something? Are you, progressing your body?
You're
so, like,
cycling every month, potentially, right?
Exactly. Like, there is just so much of, like, maintaining that balance that's, like, we don't look at our success as, like, oh, we've gotten this patient better in 2 visits. Like, no. Like, we want to make sure that, like, you feel good in your skin 365 days a year.
Right.
Like, and when you feel good in your skin, like, you show up for yourself. You show up for your family. You show up to this world in a different form because you feel really good. And then you can go spread that joy and, like, that goodness to everybody else, right? And, like, that's the evolution that we want to see. That's what we're trying to change. And, like, and I think... And that stems from the mindset that's behind body motion protocols.
Right. And
the mindset is prevention. The mindset is we prevent those birth traumas. We prevent having to, fix those birth traumas postpartum. Now, there's trauma is trauma, and birth itself is trauma, right? And you have to recover after you have birth. But, like, it's like the prevention that is locked in and baked into every aspect of every single protocol. I think that's the mindset. And it stems from also, it's selfish as fuck. Like, I want to grow old to be a really healthy, badass motherfucker on the ice at 90. I want to be that lady, you know? I want to be strong. I want to be able to, like, last night I got checked from behind and fell flat, and this really big guy fell on me. And I got up and I felt great. And I was just like, and people were like, oh my God, are you okay? And I'm just like, yeah, I'm almost 39.
Yeah.
Like, ask
me.
me when I'm 90, okay?
Yeah.
But, like, that's, like, you know what I mean?
Yeah.
That's, like,
Totally.
so it is selfish, and, like, the fact that, like, I'm just trying to do everything to optimize my body and trying to share what's worked as well.
Right.
And
maybe you don't have 365 days of, like, perfect pain-free living, right? But hey, you know exactly what you need to do, and you know you can come in and get treated, and then that's going to help you move on. So just the education on that piece of the maintenance and needing kind of constant help with your pelvic floor is also so important.
100%, because I have my things. I have my prolapse. I have my SI pain that's from patterns of a knee surgery years ago.
Right.
And it's like, I just want to try and prevent that from being a hip replacement. Try and prevent that from being a bladder surgery.
Right.
So it becomes a bladder surgery.
Right.
Okay, now I want to prevent myself from getting wheelchair status or diaper status. You know, and it's like, you're going to have things. Everybody has their things, and it doesn't mean you're a failure. It just means that, like, we get to continue to balance. Because healing is optimization. Optimization is healing. They're all one and the same. So the more that we try to continue to progress and, like, do everything for our wellness, like, we're also doing everything for our optimization, which will contribute to the world, make it a better place. You get it.
Love it. And we'll kind of wrap up here, but I know, you know, we are hiring here at Body Motion PT, so
we are always hiring, but we are now hiring.
So if any PTs are listening to this podcast or watching this on YouTube, what would you say to them in, like, why they should join our team?
We just have, our culture is magical.
Obviously.
I think we see, my mission is that, like, you want to come to work, you love being here, you love being with your family, and you love thriving out of here and in here. And I think everyone that is a part of this team is, like, just believes in women, believes in women's health and women's optimization from, like, through and through. And so there's, like, a constant pursuit of, we're all trying to, like, grow and become better people.
Right.
And be on this path to help other people do that same exact thing. So, yeah, I think if you fit that bill, apply to join our team. It's just really special.
We'll link the job ad below.
Yeah, we'll link the job ad. Only apply if you're a licensed physical therapist or physical therapy assistant, or want to move to Washington.
Or want to move to Seattle. Yeah.
We might help you. We might help you.
Yeah.
Great.
Okay.
That's a wrap. Thank you so much for joining us on this podcast. Have a lovely day.
Bye.